Hello, I'm Celia Grigg. I am a research midwife from New Zealand, working here at the University of Nottingham on a project on midwifery-led units led by Dennis Walsh. What I've been asked to talk to you about is data analysis, and I will talk to you about my PhD study done in New Zealand as a bit of an example of mixed methods research in action. The Evaluating Maternity Unit study, or the EMU study, was a mixed methods prospective cohort study based in New Zealand. So what we were looking at, we were evaluating freestanding midwifery-led units and looking at women's birthplace decision-making, transfers and clinical outcomes. So there were lots of parts to this. It was grounded in a pragmatic approach, which is a bit outside of your standard frameworks, but we wanted to provide a practical, applicable, robust evidence which could inform midwives, women, planners and funders. And the mixed methods methodology, it combines quantitative and qualitative research, and that enables me to describe, evaluate, explore and understand the issues in question. So you get a lot more complexity. It's harder to do than a simple qualitative or quantitative research project, but I had a big project to do. So it's different from the sort of project that you'll be having a go at, but I'm really going to talk to you a bit about the analysis that we applied. So briefly, the methods we used was a prospective cohort, meaning we recruited women antenatally and we reported on their birth outcomes after the event. We didn't do anything to them. We just waited to see what happened for them and reported that. We had 2 postnatal surveys written, which they chose to receive either as email or post, one at 6 weeks after they had their baby and one at 6 months. And we ran focus groups for women who then opted to talk to us in more detail. So we had 2 groups of well women, those planning to give birth in a freestanding midwifery-led unit and those planning to have an obstetric unit birth. All of them could have given birth in a freestanding unit. And today I'm just going to describe the analysis of the women's birthplace decision-making data. So there's a whole lot more which you can access, but just wanting to look at those that aspect. We aim to explore women's birthplace decision-making, and we ended up using 2 types of analysis. So the first one we used was a content analysis. So we looked at the data we had, which was numbers from the surveys, including closed questions, so Likert scales, meaning women were asked to choose from a range of responses from, very much to not at all, or it depended on the question. So that gave us numbers. And we did some descriptive statistics, so looking at the percentages of women in each group that replied, answered a particular way. And we did do some serious stats on them, and to give a sense of the differences between, or the similarities between women's responses. So that gave us tables of different kinds, which showed us those illustrated the differences. So in one of the articles which the team will add to this is page 9 of the women's birthplace decision-making article, illustrates, that sort of visually how you can demonstrate the differences between, or similarities between, women's responses from the different groups. And what we got was we also got words from the women from the open-ended survey questions. So women wrote quite a lot in the surveys, and also from the focus groups. So what we had was both numbers and words, and part of mixed methods is you take them both and then you integrate them, you look at them together, which is a little bit tricky, but you can you can consider them separately if you're wanting to. So what we did was compare the responses and looking for similarities and differences. And some beliefs were identified in that content analysis. And we obviously interpret the responses from our beliefs. So, for example, I've got a couple of quotes for you, and to illustrate how these different kinds of responses, how we interpreted them. So one woman who was planned an obstetric unit birth, this is looking at their perspectives on childbirth. So she said, I had a couple of people going, oh, but it's all just a natural process and it's all good and you should all be fine. Well, actually, if you look around the world, most of the women die in childbirth. That's the riskiest thing women do. I wasn't terribly impressed with that argument. So she expressed some views, a worldview, if you like, of childbirth. And a woman who planned a freestanding midwifery unit birth, one of the things she said was, I think the obstetric hospital, it's a hospital, which if you're sick or if you had an accident, that's great. That's exactly what you want. But I wasn't sick. I was having a baby. It's a perfectly natural process that millions of women all around the world have managed to do without nice, shiny hospitals. So for us, we see what we call data, those women's views, and we interpret them. And one of the things that we do is then say, well, they, from our worldview, they represent in a way, the medical or technocratic model from the obstetric unit and planning woman, or the midwifery holistic social model of childbirth from the woman planning the FMU birth. So we take their words and obviously interpret it within our, views. It's what we're not trying to do is say, we're not putting words into women's mouths, we're taking their words and interpreting them. So after we'd done that and reported that part of women's decision-making data, we then did a deeper thematic analysis. So the first lot was content analysis. We looked at the words. What words did they use? And we just presented those words. So we didn't do a lot of interpretation. So the quotes I gave you were just sort of a little bit of that. But it was obvious for us when we were looking at the data that women were expressing their beliefs and values, and we had to look at that data in a different way in order to report those or find out what we thought they were saying and how they were expressing them. So what we did, looking at thematic analysis, we're looking for meanings and relationships, beliefs and values. We're not just looking at the words they're using, we're kind of looking behind those words to see what it was they were expressing. So we report the patterns of that come out as themes. So those themes came out that safety was an overriding theme for all the women, both those planning a freestanding unit birth or those planning an obstetric unit birth. But then under those themes, we identified another theme which fitted into 5 different types of confidence. So these women are talking about confidences they have in different things in order to be able to plan a birth away from an obstetric unit. So we found that women who planned an FMU birth, they expressed confidence in the birth process, in themselves and their ability to give birth, in their midwife, in the system of transfer, referral, consultation, and in the birthplace itself, that maternity unit itself. Now, they didn't all express confidence in all of those things, but there was a really strong commonality, whereas the women who planned an obstetric unit birth definitely didn't express any confidence in the birth process. They felt that at any time it could go wrong. It didn't matter how well they were. It didn't matter any of the care they received, they didn't trust the process. They had varying experiences of having confidence in themselves and their ability to give birth, so some of them really weren't confident. Almost all of the women had confidence in their midwife, so of course they have their own midwife because it's in New Zealand, and it didn't matter where they planned to give birth or did give birth, they still had their own midwife. So having confidence in their midwife alone wasn't enough to help them plan to give birth in a freestanding unit. So the women who chose an obstetric unit birth didn't have confidence in the system. They weren't so sure that they'd get a transfer in time if they needed to be transferred in labour, and they weren't that confident that the place, the freestanding unit, had the facilities and the people with the skills that they needed if things didn't progress normally. So the same set of data we looked at in a different way came up with another level of understanding of what women were thinking, believing about birth and their where they'd like to give birth. So we used a different lens to view and analyse it, but both of them were important. They tell different aspects of women's birthplace decision-making story. So they're different ways of analysing the same data, and they give us different things, but it's not that one is any better than the other, because we need to understand, with the content analysis, we looked at the factors and people that influenced their decisions and how much these women believed that different things and different people influenced their decision making. And that's a really important baseline to start with of where they believe things are. But to learn about what might actually those beliefs and values might be, they're much harder to address. And things like notions of confidence, that's much more complex to address. But unless you do it, you're not likely to change, to help enable more women to give birth in a freestanding midwifery-led unit, if you just think it's about the factors and the people that are influencing their decisions, and you're not considering the women's beliefs and values that are underlying those other things. And that might help you have different conversations with women antenatally and to have a different understanding about the depth of those beliefs and values, that you can talk with women as much as you like about, how nice a unit is or how good midwives are or whatever, but if actually you don't address their underlying beliefs and values, which we kind of began to discover in this, then they're unlikely to make a different decision. They might nod and smile, but they're not going to change their plan. So that's a wee bit of an idea of the way we took some data, and you can have a look at that, what we've done with that in the research articles that we've published. So I hope that that's useful for you.